Welcome, students of class 7th of Central School for Tibetans, Dalhousie. Today we will be discussing the chapter 2nd of Social and Political Life, Civics. The name of the chapter is Role of the Government in Health. Table of contents will be what is health, healthcare in India, public and private healthcare services, healthcare and equality, Kerala experience, and Costa Rican approach. To begin with, let us define what is health. Health means our ability to remain free of illness and injuries. Apart from disease, there are some other situations and factors that affect our health. For example, if people get clean drinking water or a pollution free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or have to live in cramped conditions, they will be prone to illness. It is not healthy to be dull, inactive, anxious, or scared for long stretches of life. We all need to be without mental strain. All of these aspects of our lives are a part of health. Now let us take up the healthcare facilities in India. In order to prevent and treat illnesses, we need appropriate health care facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illnesses. We also need the medicine and equipments. Now this is a table which shows what development the country has made in the healthcare area since 1947 and what is the actual scenario of the healthcare facilities in India. Now let me talk about the what growth and development we have made in the healthcare facilities, how we have improved the healthcare of the country. To begin with, India has the largest number of medical colleges in the world and is among the largest producers of doctors. Approximately 15,000 new doctors qualify every year. Healthcare facilities have grown substantially over the years. In 1950, there were only 2,717 hospitals in India. In 1991, there were 11,174 hospitals, and in 2000, the number grew to 18,218. In other words, there was a huge increase in the number of the hospitals. It increased from 2,717 in 1950 to 18,218 in 2000. India gets a large number of the medical tourists from many countries. They come for treatment in some of the hospitals in India that compare with the best of the world. India is the fourth largest producer of the medicine in the world and is also a large exporter of the medicine. Now, this was a scenario of what development we have made in the healthcare area since 1947. Now, I will be discussing what is the real position on the ground today. Most doctors settle in urban areas. Though the number of India is producing approximately 15,000 new doctors every year, but Real situation is most of these doctors settle in urban areas, and people in rural areas have to travel long distances to reach a doctor. The number of doctors with respect to the population is much less in the rural areas. About 5 lakh people die from tuberculosis every year in India. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number isn't decreasing. Further, if we will look into it, we are not able to even provide clean drinking water to all. 21% of the all communicable diseases are waterborne. For example, diarrhea, worms, hepatitis. Half of the all children in India do not get adequate food to eat and are undernourished. This is the two scenarios. Now, talking in comparatively in more detail, India has a large number of doctors, clinics, and hospitals. The country also has considerable experience and knowledge in running a public health system. This is a system of hospitals and healthcare centers run by the government. It has the ability to look after the health of a large section of its population scattered over hundreds of thousands of villages. Moreover, there has been a phenomenal advancement in medical science whereby many new technologies and treatment procedures are available in the country. However, the second scenario is this: we have the poor health situation in our country. With all the above positive developments, we are not able to provide proper health care facilities to the people. This is a paradox, something that we contrary to what we would expect. Our country has the money, knowledge, and people with experience but cannot make the necessary health care available to all. Now, health care services in India can be divided into two categories: public health services and private health services. Public health services are those services which are provided by the state, and the private health services are those services which are provided by the private entrepreneurs. Now, talking about the public health services separately. The public health service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illness to special services. The healthcare services is called public for many reasons. In order to fulfill its commitment of providing health care to all citizens, the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality healthcare services either free or at low cost so that even the poorest of poor can seek treatment. Another important function of the public health is to take action to prevent the spread of diseases such as tuberculosis, malaria, jaundice, cholera, diarrhea, chikungunya, or it may be COVID-19. Now, this is a figure which is showing the doctor in a rural healthcare center giving medicine to the poor to the giving medicine to a patient. Now another figure is there. It is showing the patients usually have to wait in a long queues in public hospitals like this one in the figure. This is again the one more image. It's a mobile checkup clinic in rural areas. Then this is a pregnant woman in the village. She has to travel many kilometers to see the qualified doctor. Now this is one more scenario of the public health facilities in the country. There's a long line outside the government hospital, government healthcare center. The long queue is there where the people are waiting for their turn to get them treated from the hospital. Now this is the image of the All India Medical Sciences, Delhi. It is one of the most prestigious medical institute of the country. Even people come from outside the country to get treatment over here. This is a institution which possesses almost every modern facility of world global standard. Now this is our health minister inaugurating a mobile testing facility for COVID-19. Mr. Harshvardhan, our health minister, is inaugurating the mobile testing facility center of COVID. Now one more picture of the same public health facilities is the Prime Minister of India, Shri Narendra Modi, inaugurating a 500 crore hospital in Gujarat. Now regarding to the public health facilities, but though government is committed to provide the health care facilities to all, irrespective of the economic standard of the people. But in real, the situation is a little bit different. In this case, I will tell you one story. It's a story of Hakim Sheikh. Hakim Sheikh was a member of the Paschim Banga Khet Mazdoor Samiti, an organization of agricultural laborers in West Bengal. One evening in 1992, he accidentally fell off a running train and suffered head injuries. He was in a very serious condition and needed immediate treatment. He was taken to the government hospital in Kolkata, but they refused to admit him because they did not have a spare bed. Another hospital did not have the facility or the specialized doctors necessary for this treatment. In this way, he spent 14 hours in a critical state and was taken to the 8 different government hospitals, but none of them admitted him. Finally, he was admitted in a private hospital where he received treatment. He spent a lot of money on his treatment. Angry and upset over the indifferent attitude of all the hospitals that refused to admit him, Hakim Sheikh and Khet Mazdoor Samiti filed a case in court. And now you will be definitely curious to know what court exactly said in connection to this case. According to our constitution, it's the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The government must safeguard the right of the life of every person. The court said that the difficulty of Hakim Sheikh had to face would have cost him his life. If the hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situation. Hospitals and the medical staff must fulfill their duties, providing the necessary treatment. Hakim Sheikh was denied treatment at the various government hospitals. Therefore, the court asked the state government to give him the money that he had spent on his treatment. Now, this is basically the situation and the scenario of the public healthcare facilities in the country. Now, let me talk about the private health facilities. Private health facilities are not owned or controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. Today, the presence of private facilities can be seen all around. In fact, now there are large companies that run hospitals, and some are engaged in manufacturing and selling medicines. And medical shops are found in every corner of the country. Now, this is a figure which is showing the post-operative room in leading private hospital in Delhi. Another photograph is there. It is showing the facilities inside the private hospital. Now, healthcare and equality. In India, we face a situation where private services are increasing, but public services are not. What is then available to the people are mainly private hospitals, which are mainly concentrated in urban areas. As these services are run for profit, the cost of these services is rather high. Medicines are expensive, many people cannot afford them or have to borrow money when there is an illness in the family. In fact, barely 20% of the population can afford medicine that they require during an illness. Hence, even for those whom one might not think as being poor, medical expenses cause hardship even to them. It was reported in the study that 40% of the people who are admitted to the hospital for some illness or injury have to borrow money or sell some of their possessions to pay for expenses. For those who are poor, every illness in the family is a cause of great anxiety and distress. What is worse is that this situation tends to happen again and again. Those who are poor are in the first place undernourished. These families are not eating as much as they should. They are not provided basic necessities like drinking water, adequate housing, clean surroundings, and therefore are likely to fall ill. Expenses on illness make their situation even worse. Now, what can be done in this particular scenario? There is a little doubt that health situation of the most people in our country is not good. It is the responsibility of the government to provide quality health care services to all its citizens, especially the poor and the disadvantaged. However, health is much dependent on the basic amenities and social conditions of the people as it is on healthcare services. Hence, it is important to work on both in order to improve the health situation of our people. Now, Kerala experience. Kerala has done some special measures in this particular field and have shown great improvement in the healthcare facilities in the state. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to the panchayats. They could plan and provide for their requirements. This made it impossible for a village to make sure that proper planning was done for water, food, women's development and education. This meant that water supply scheme was checked. The working of schools and Anganwadis was ensured, and specific problems of the village were taken up. Health centers were also improved. All of this helped to improve the situation. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and these needed to be addressed. Now, the Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in the South America. The main reason for this can be found in the Costa Rican constitution. Several years ago, Costa Rica took a very important decision and decided not to have an army. This helped the Costa Rican government to spend the money that the army would have used on health, education, and other basic needs of the people. The Costa Rican government believes that in a country had to be healthy for its development and pays a lot of attention to the health of the people. The Costa Rican government provides basic services and amenities to all Costa Ricans. Now, this is all about this chapter. Now, lastly, we are having the homework or assignments. What is meant by health? What is meant by health? By health, we mean when a person is free from diseases and free from injuries. What are the different ways through which the government can take the steps to provide health care to all? Now, what steps government can take to provide the health facilities to all? It can increase the number of doctors, number of paramedical staff. It can increase the number of medical services, hospitals, primary health centers. Many other steps can be taken by the government, and these steps you have to explain in this particular question exactly what government is doing, rather what steps government had taken and what steps government can take in this particular regard in order to increase the medical facilities in the country, so that medical facilities will remain available to the people, whether he is living in the rural area or he is living in the urban area, whether he is a rich or he is a poor. Rather, medical facilities, health facilities should be available to every citizen of India. What efforts government should make and government has made to provide health care facilities to all. What is the difference between public and private health services? Look, public health facilities are those facilities which are being provided by the government of country, which is free or they are very low, less money is paid to be paid. This facility is run by the public money, the money which is paid by the taxpayer. Now, so far as private health services are concerned, they are health services which are run and managed by a particular individual. A companies invest in it. They open their nursing homes and others, but where the patient has to pay the lot of money, because they are basically open for the profit purposes. So they are very expensive. The poorer person in the country are not in a position to afford or to make use of this facility, because it is normally out of the pocket of these people. Improvement in water and sanitation can control many diseases. Definitely, if we will be using the potable water and proper sanitation will be there, many diseases will not occur, like jaundice, like cholera, like such diseases will not remain there if our water will be potable and sanitation will be up to date. You attempt these questions. If you will be able to do them. It's okay if you are unable to do it. Do any one of them, or you have not understood any point from this lesson. You feel free to contact me on WhatsApp or on telephone. I will be addressing your difficulties, your problems, your doubts instantly. Thank you very much. Stay home, stay safe.